Dr. Bonati is proud to be an American citizen and is grateful that we have the right to speak out against certain policies and politicians when we feel the measures they are taking create more problems than solutions. The recent passing of a $1.1 trillion spending budget should be a concern to everyone. In one of the last acts of this Congress, they found ways to retain cuts from previous budgets and roll back some banking regulations. But it also retained spending for Obama's health care law. Here are Dr. Bonati's thoughts on the subject. Dr. Bonati, the reason we're here is because of the $1.1 trillion budget that this Congress passed that's supposed to get us through the next 9 months. What do you think about, they got their bank rollbacks, they had some other things being taken care of, but one of the things that didn't get repealed was Obamacare, and in fact, part of that $1.1 trillion goes on to further fund Obamacare.
Well, this is exactly what politics is. I'm very disappointed the way that the Speaker of the House is behaving, is interviewing and discussing things with Obama and with Reid and with all the upper echelons of the Democrats to have solutions, and that's why this $1.1 trillion was passed. Problem is, the Republicans were elected to do a change. The Republicans were elected because we're tired and upset of all this abuse of a socialistic society. Remember, one Democrat said something that today will sound like a very strong Republican. And Kennedy said one time, it's not what the country can do for you, it's what you can do for your country.
Correct.
And unfortunately, that situation today is totally reverse. Is what the country can do for the useless, irresponsible, and takers of this society. And unfortunately, they're getting bigger and bigger and bigger. And the taxpayer people and the hardworking people are being squeezed to a level that practically working is not worth it anymore. Okay. So that's why a lot of people are quitting. Physicians are leaving their practices. The whole structure, because of these men in the government, is so ill, so totally sick, that to be able to cure this situation, it's going to take us many, many years.
I have another question for you, Dr. Bonati. As far as Obamacare, from the onset of Obamacare through this past year, how would you say things have advanced, either good or bad, and then where do you see Obamacare still headed?
Well, Obamacare is a fraud, and it's a scheme on the population. And it's like every scheme on the population created by politicians in any socialistic society. They lie at you, they give you false representations, they give you false promises, and few people are going to have some benefits. Usually the people who deserve the least is going to be the ones that are going to have the best results for them. If you never have an insurance and then suddenly now somebody offers you an insurance, you're going to appreciate that. But if you work to pay for the insurance and you work to be able to be an individual that is committed to your family and to your work, you're going to suffer the consequence of all this law. So I hope the people will start to wise up and start to look and never go and get any Obamacare. And the doctors, they need to walk out from Obamacare and say, we're not going to take this garbage, and we are not going to serve the patients bad. We're going to have a great amount of population that are going to be really being treated poorly, with a poor results. We'll have a really sick people. We will have a tremendous amount of increase in disability, and we will be paying thousands of dollars of people who is going to be sitting on their houses with diagnoses that are false diagnoses, or incompetent diagnosis. This is the future that we're seeing.
Well, that's pretty sad, Dr. Bonati.
Well, and that's why today we need to start to think seriously, and physicians need to stand up and say, we're not going to take nurses that they have less than this amount of training. We are not going to take Obamacare. We're not going to take Medicaid. We're going to discuss how are we going to take Medicare, because the people with 65 years old and older, they pay for that program. It's not an entitlement. It's an obligation of the country to maintain that program because the people pay for it. But at the same time, we need to beef up that program to be able to be capable to treat these individuals with the most advanced procedures and with the best technology, and instead to offering them poor technology or denying services.
Thank you for watching American Medicine Today. We hope you've enjoyed learning about these new and exciting medical advancements, as well as discovering that you do not have to live with back pain, regardless of what you've heard from other medical professionals. Stop suffering and seek a consultation to see if the world-renowned Bonati Spine Procedures can help you. If you are a doctor or a medical innovator who would like to be featured on our show, please email request@americanmedicinetoday.com. If you have any comments or questions, please feel free to contact us at the number below. When you do, please speak clearly and leave your name and number. You can tweet at Dr. Bonati or hashtag American Medicine Today or hashtag AMT. We respect your views and opinions and would like to hear from you.